Hello everyone, welcome to today's lecture. In this video, you will learn non-pharmacological treatment in advanced health assessment in psychiatric care. In this video, you will learn individual therapy, group therapy, family therapy models, complementary therapy, alternative therapy, psychoeducational engagement strategy, case study examples, and then I will summarize the lecture. So thank you and stay tuned. These are the discussion questions that I will answer in the end of this video. Non-pharmacological treatment are essential in mental health care. People who've been in therapy will tell you that they benefit from the therapy because therapy addresses emotion, behavior, and relationship issues. It's effective for diverse population and diagnosis. Individual therapy is held one-on-one to build the therapeutic relationship with the client and tailored to the client needs and goals. It builds insight, coping, and resilience. Supportive therapeutic principle uses client strength, existing coping mechanism, focus on present function, uses empathy, encouragement, and reassurance. Psychodynamic therapy basis. Psychodynamic therapy basis explores unconscious process, past experience, focus on insight and emotional expression, transferency and countertransferency awareness. Cognitive behavior therapy, CBT, is a structured therapy, time-limited, and evidence-based. It focuses on thoughts, feelings, behavior. It's effective for depression, anxiety, PTSD. So, what are the CBT techniques? CBT techniques include cognitive reconstruction, behavior activation, thoughts recordings, homework exercise, and exposure therapies. What are the behavior therapy approaches? Behavior therapy approaches focus on modifying maladaptive behaviors, uses aberrant classical condition principles, and includes exposure, reinforcement, and modeling. Dialectical behavior therapy, DBT. DBT is developed for borderline personality disorder. It combines with CBT with mindfulness and acceptance. It focuses on emotional regulation and stress tolerance. So, what are the DBT skill models? DBT skill models include mindfulness, distress tolerance, emotional regulation, personal effectiveness. Interpersonal therapy, IBT, is a time-limited therapy. Structural therapy is focused on interpersonal relationship, social function, addresses grieving, role transition, and disruption. Motivational interviewing principles is a client-centered and directive method. It enhances intrinsic motivational to change of the client. It uses open questions, affirmation, and reflection. What are group therapy? Group therapy is a therapy with multiple participants. It's a cost-effective and supportive. It promotes shared experience and feedback. There are different types of group therapy based on client needs and goals. They include psychoeducational group, supportive group, process-oriented group, skill training group. What are the group dynamics and stages? Group dynamics and stages include forming, norming, storming, performing, journey. Group adhesion and safety is the key. Facilitators guide the process and the safety of the group. Family therapy. Family therapy focuses on systems, not just the individual. Improves communication and problem solving. Involves multiple family members. Structural family therapy focuses on family organization, arcs, therapist choice, structural interaction, clarification of the boundary and the roles. Strategy family therapy focuses on problem in the family, directives, uses, tasks, paradoxical interviewing, aims disrupting the dysfunctional pattern of the family or the family members. Bowen family system theory emphasizes intergenerational patterns, and differentiation of the self is central. It uses genomographic to map the family dynamics. Solution-focused therapy is a brief, it's goal-directed approach, focus on strengths and solutions, uses scaling questions and miracle questions. CATs are the complementary and alternative therapy, uses alongside or instead of conversational therapy. It uses conversational therapy, include body and mind and nutrition and movement-based approaches. Is a crown evidence base for the many cats. Mindfulness-based interventions include present moment awareness without judgment, mindfulness-based stress reduction, mindfulness cognitive therapy. It reduces stress, anxiety, and depression. Meditation and relaxation techniques include breath exercise, guided imaging, progressive relaxation, promote calm and reduce arousal. These techniques are accessible and low cost, so anybody can practice. Yoga and movement-based therapies is combined with physical postures, with breath and mindfulness. It improves mood, sleep, body awareness, adaptable to many people. You can exercise when you can move when you are sitting or standing, if you are weak, if you are strong, if you are pregnant, if you are elderly, if you are teenager. So it can be, anybody can use it based on their physical or energy or ability. Nutrition and herbal interventions include omega-3 fish oil, folate, vitamin D, but be aware of the interaction between the supplements and the side effects they can cause. Sleep hygiene interventions. Most of us need sleep hygiene interventions. Sleep hygiene interventions regulate sleep schedule, environment, limit caffeine, screen before sleep. CBT intervention is golden standard for insomnia. Psychoeducation principles is to provide information about the illness and treatment and to empower the patient and the family to reduce the stigma and improve outcome. Patients, when they know the treatment and their illness, their emotion and mood will improve. And through that, when you educate the patient and the family, you will also build a bond. Therapeutic alliance and engagement is the foundation of the effective therapy. Build on trust, empathy, and collaboration. It predicts treatment adherence and treatment outcome. So the patient, when they engage their treatment, when they know their diagnosis, when they know the outcome and the treatment plan, they will be adhesive to that, and they will be cooperative, and they will trust the provider, and they will trust the plan, treatment plan. So that is why it's important. Cultural considerations in therapy. Respect cultural value and beliefs and use cultural adapted interventions, addresses language and accessibility barriers. If the patient don't if the client. Our first case example is a client with panic disorder who began CBT therapy, uses exposure and cognitive reconstruction, and then responds to reduce the avoidance and anxiety. Our second case study example is a teenager with family conflict and engaged in a constructive family therapy that improve the communication and boundary. Our lecture summary include non-pharmacology therapy are diverse and effective. They include individual therapy, group therapy, family therapy, and complementary approaches. They are tailored care and improve his outcome. Our key takeaways include use evidence-based therapy models, build a strong therapeutic alliance, and incorporate cultural and individual factors in the treatment to be effective. Our discussion questions. First question answer is focus on the person, problem, and the mechanism of a change. Second question answer is diversity, personality, group dynamic, emotional intense. Third question answer is gradually exposure, control environments, and behavior monitoring. That is it today, but thank you for joining me today, and I would love to see you in my next video.